I am beyond thrilled that Needy has taken the time out of her busy schedule to be here with all of us. How are you, Needy? Thank you so much for joining Love at First Science.
Thank you. Thank you for having me. Really excited to discuss everything with you.
My love, can you just give us a brief introduction about who you are, what's your background, just so everyone has a bit of context around your incredible knowledge that you're going to share with us?
So I am a pelvic health physical therapist. I'm practicing in New York. I have been a PT for about 13 years. I'm an orthopedic specialist and a women's health specialist. So my approach to treating things is kind of stepping back and looking at pelvic floor as part of the whole body. I am also a new mom. I have a 10-month-old. So,
Yay, congrats.
Thank you. So I try to practice what I'm preaching and, going through all the challenges that I hear my patients talk about.
I mean, I'm so glad you brought this up because I think one of the, I am obviously here on my high horse talking about things, but I haven't had kids. And I think that a lot of times we don't really know what it's like until we've actually been through that experience. And so for you, with all of your knowledge you have, would you say that all that knowledge kind of helped you through the process? Or would you say sometimes you were like, oh my goodness, this is very different to what I thought it would be like?
It definitely helped me. I was guarding and I kind of knew when things happened to me that, oh, this is what it is. But with my knowledge, I thought, oh, I'll take care of this. But that wasn't always the case. And I think one of the things I realized is that you really, really don't have time. You don't have any time, which, I tell my patients to exercise, and I realize that I'm asking them to do impossible things sometimes.
Yeah, it's so intense for the new mums. I see how burnt out they are. Like, obviously, not only do you not have time, you're actually also not sleeping, which is not ideal. So, I mean, with your experiences that you've had, I mean, you've had 10 months now of practice. Not only are you this amazing physical therapist that's helping so many people, but you've had 10 months of being kind of in the deep waters of having a newborn, rearing them into little human. Have you got any tips for the mums out there, especially around the topic of core? Because there is a real pressure on mums to get back to exercise, to get their six-pack back. But what would you say has been really, I guess what I'm trying to get at is, what are some myths that maybe you can bust for us? And what are some tips that you can give mums that are more practical?
Okay, so I guess the first thing, there's no bouncing back. There's just no bouncing back that happens. Postpartum is forever. Postpartum is a new body. It's not a bad body. It's just a new body. It's a different body. So at this point, you really do have to start from connecting with your breath, connecting with your pelvic floor. And hopefully you have practiced these things when you were pregnant. It makes it so much easier. So if you're pregnant and you have an opportunity to go see a pelvic floor physical therapist during pregnancy before giving birth, it'll be so helpful. I was doing deep core contractions and deep core activation, not really contraction, 1-2 hours after giving birth. So it's something that you can start right away. And if you start there right away, the muscle memory kicks in so much quicker.
Amazing.
So,
and can you walk us through what that exactly means and looks like for a new mom that's maybe just given birth? Like, what would a deep core activation look like or be like?
So basically, you are working with the diaphragm. Diaphragm is the breathing muscle, which is right under the rib cage. Pelvic floor is a hammock, like a sling-like muscle inside the pelvis. And then there are core muscles around the trunk. So we're working with the deepest muscles of the core. We're not going to name them complicated names. So these three muscles, you're going to inhale and relax your belly, or inhale into your rib cage on all sides. And then you exhale through your mouth, or you can do nose. Mouth is a little bit easier. Exhale through your mouth, and then gently think about pulling. If you have a tampon that's falling out, think about pulling a tampon in. And I often say the way you're going to make your contraction better or stronger or more connected is by prolonging your exhale. Don't think about squeezing and holding the pelvic floor contraction. See if you can prolong your exhale. So first slip and go, and longer you can go, the pelvic floor will come along for a ride. And we're not talking about strong contractions, you're not building muscle mass, you're just activating. So I would say 50%, 70% of your best contraction is pretty good. You just repeat it. Keep repeating it, 2 contractions every hour. That's it.
I guess the cool thing about that, you can literally just do that anywhere, anytime, if you're breastfeeding or if you're carrying your baby. So it's not like a separate thing that you've got to weave into a busy schedule as a new mom. So I really love that suggestion. And actually, that is one that I've been teaching because I'm one of Julie Weeb's students. I don't know if you've come across Julie Weeb.
Yes,
we all love her.
Yes, I love her so much.
I love her so much. Yeah, so she's been on the podcast and she spoke about the use of the diaphragm and the importance of actually relaxing. And I love the tip you gave. And actually, I'm really trying to get the message out there. One of the myths that I alluded to earlier was that I think a lot of people are under a lot of pressure to always hold their core in and tight, especially through movement. And one of the reasons I wanted to start the podcast was to bring people like you in to talk about actually how this is not necessarily the best way. So can you give us your insights as a physical therapist and someone who works with postpartum women?
Yeah, so, think of it as a spring. An old spring that has lost its flexibility is going to lose its power. So if a muscle cannot stretch, it cannot contract. It doesn't have anywhere to contract to. So one of the things that holding the core tight does is it creates a stiffness, which might give you the feeling of strength, or it might even work for a few minutes or prolong, but it's not gonna work for a long period of time. And 2, it's not gonna work by itself. So we say anticipatory core engagement. That's been the term that we've been using for past few years, which means you don't think about it. Okay. Yeah. So if you can weave your core activation into something that you automatically do, then it will automatically, hopefully, work. And what do you automatically do? Breathe. So if you can weave your contraction into breathing, then when you breathe in, the core automatically relaxes, or it's not even relaxing, it's lengthening, which is a different kind of contraction.
It's like eccentric, isn't it? There's still a load in the muscle, but there's an expansion at the same time.
Exactly. So it's lengthening, but it's still contracting, it's still working. And then when you breathe out, it automatically contracts. I'm doing it with my hand, I know you can't see it, but this up and down motion, like a wave of contraction, relaxation, contraction, relaxation, is how the core works. It doesn't work by creating a wall. It actually works by creating some sort of a trampoline. So I often say, don't hold your pelvic floor all the time. People have this habit of holding their pelvic floor when they run, which almost always backfires. Because you get tired. You get tired to a point, and then suddenly you have a big leak instead of a small leak. So I would rather have you run with a good breath pattern, and then stop when you feel like you can't quite control the leaking. And that's probably your limit at this point, and you're gonna keep getting better at it.
Oh, so good to hear you talk about the stuff. And like I said, I just want to bring in lots of clever people like you that have what I feel, I know we've been talking about this for a few years, but it is quite cutting edge, especially in the fitness world, to be talking about allowing your core to expand on the inhale. That is something that's still, I feel, not really the mainstream message that's out there.
Yes, absolutely. And, chest up, core tight. I've heard it so many times. I treat a lot of people with pelvic pain and hernias who have been doing chest up, core tight, and have given themselves hernias doing that, because if you never let the core expand and then you load it because you're lifting, where will the pressure go? Okay, it can't go anywhere. You're not breathing out, you're holding your breath, you're holding a pelvic floor contraction, so it starts to push out through the abdomen and create hernias. So it's been so important, especially in the fitness world where they're lifting a lot, loading a lot, to talk about really letting that pressure expand, pressure escape somewhere.
Yeah, and you
cannot
know, it's
hold.
so difficult because I speak quite openly about this to everyone that I had sort of low grade leaking. And for such a young person, I mean, it's just crazy, you know. And it was especially when a strong cough or a sneeze came along. And I was the biggest person who was always talking about engage your core. You need a strong core through all your movements. And obviously, then I met Judy Weeb, my friend Sarah Parker, who's obviously, she actually introduced me to you. She said, you've got to follow Needy Sharma, who's just so amazing. And
Oh,
she was educating me about actually, you've got to allow the pressure system to adapt. It was interesting because I was actually stalking you quite a bit before we did this interview. And one of the things that you speak about on your Instagram page, please everybody follow Needy. It's Think Beyond Pain, right? That's your handle, which is just such a genius name. Think Beyond Pain, guys. Definitely check out her incredible content. One of the things you're talking about that even the diastasis recti can be caused by doing something like sit-ups, right? Is it one of the contributory factors?
so we don't think that exercises cause diastasis, but we're saying that if you're going to do things that make the bulge appear more, uh, it's not it's not building muscle memory. It's building muscle memory of more bulge rather than doing the
Okay.
things that will control the bulge. I don't think research quite supports the fact that any exercise is making the diastasis worse, because
Okay.
diastasis take months and months and months of hormonal changes to happen. I don't think a little bit of sit up is going to make it worse, but I think I want my patients to focus on the fact that what's going to make it better.
Okay, so what
So
kind of suggestions would you give? So guys, quick side note, diastasis is when a big belly, not just a pregnant belly, and men get this as well, even guys with six packs sometimes get this,
yeah.
but it's the little middle part between their six pack muscles comes apart.
Uh-huh.
Have you got any tips and suggestions for folks listening on how they can improve this?
So unfortunately, diastasis is extremely individualized. Two things I say, one of the things is the deep core engagement that we talked about it creates tension. And I think Julie talks about this a lot also, is that the space between the two sides, the little gap that is there, more than the gap, what we're looking at these days is how tense is that gap. So do you see a bulge? Do you see a little valley? Right? Is that space soft or is it hard? Can you create tension across it? So exercises that create like a trampoline underneath it where it's tension, those are the exercises we want. Sit up is usually not the first place you start. Deep core engagement is usually the first place you start. But the second thing is you really do have to load it. I think women are scared of doing exercises because they think, oh, this will hurt it, this will hurt it, this will hurt it. More often than not, it's not the exercise that's hurting you, it's how you're doing it that might not be helpful. So after the deep core engagement, if we can teach women to keep that tension across the two sides and then load their trunk, whether it's squats, whether it's planks, whether it's sit-ups, whether it's lunges, different ways to load the trunk in different directions. You really do have to be on your side in rotation, in side bending, in flexion and extension, loaded in all different ways, keeping the tension. Usually keeping the tension in a sit-up is the hardest thing. That's why we see that bulge. So it's probably not the first place to start.
So when you
Does
say
that help?
keeping that tension, how do you then
Uh-huh.
differentiate that between someone who's maybe gripping their core in a single static hold? How could you explain that to someone who's maybe, they've heard you say you've got to keep the system moving, we've got to work with the pressure system, but then they're hearing, oh, you've got to keep that tension. So how do you kind of tease out the language just to help someone kind of find the best of both worlds?
Yeah. So when you learn to create the tension the first time, we do it with an exhale, right? We exhale and we engage the transverse abdomen, the deep abdominals and pelvic floor to create a tension. Now, it's not that that's the starting place, right? As you get better, you're able to keep that engagement even when you inhale. So when you inhale and the pelvic floor lengthens and the pressure escapes, you still are able to create that tension. Now, the tension doesn't mean that the core is tight. It just means the trampoline is there and the core is expanding and contracting with the trampoline.
Okay.
So you still see the core, the trunk expand and get smaller. You just don't see the bulge expand and get smaller.
Okay.
So
how would you define the bulge? Are you talking like that little kind of pot belly that sticks out like a bread
yes.
loaf when someone does sit-ups? Yeah.
Yes.
Okay.
So if you look at my page, I have like a few, I think like maybe 2 weeks ago, I did same gap, different reality kind of a visual where one woman has a big, like a bulge, like looks like a hernia. The other one has a little tent going through her abdomen, like a little tent. And then third one has a little dip. So these are all different presentations of what the pressure system might do. Now,
oh my goodness, it's so individualized, isn't it?
it is very individualized, and which is why it's not very helpful to tell women sit-ups are bad, planks are bad, because plank might be exactly what you need at this point in your rehab, but plank might be exactly what you need to avoid. So it's hard to give an advice for diastasis. We really say that, you know, we are rehabbing the whole abdominal wall rather than just closing the diastasis. But you absolutely have to do the exercises that are hard. Being scared of the movement, having a fear of movement does more harm than good.
Nidhi, you know, I ran a core workshop recently off the back of being one of Julie's students. And one of the biggest questions which came through, which I struggled to answer, if I'm totally honest, was someone's going to do a sit-up. They want to do sit-ups. That's what they want. And they're getting that bulge. How do you then work, A, with the pressure system, but then control that bulge from not poking out?
So if you have, so let's say bulge is happening because the pressure has nowhere else to go, right? Or you're not able to create a channel somewhere else. Breath is one way, that's one escape for the pressure, okay? The second one is the abdominals have to contract so they can keep the pressure in. Third is the pelvic floor. So between all three of them, if you're not able to control, if you're exhaling efficiently for a long period of time, you know, prolonged exhale, if your pelvic floor contraction is pretty good, if your transverse abdominis or the deep core is engaging, you're able to control the bulge, but as soon as you sit up, you're not able to, it comes back. Then you probably have to change positions. You have to either increase the incline that you're doing the sit up from. You might have to decrease the incline. Sometimes I'll add a little bit of side bend or a little bit of rotation. We have to play around with what else can we give the system help in. 90% of time, I will find something that we can change and still do a sit up if that's what the patient really, really wants. But I'll tell them that, you know, if sit up is your goal, one sit up, okay, sit up can be your goal if that's what you want to do, but that's just one plane range of motion. You live in multiplanar movement. So let's see what you can do in side bend, what you can do in extension. And once I give them like 6 or 7 exercises, only one of them is flexion, others are in other movements, within some time they will show improvement in flexion also. So the whole
I wish everyone had access to you. This is just it's so clever and so simple, because yeah, instead of just looking like at the body like this one-dimensional plane that we tend to a lot in yoga. I mean, we just like forward and back, up and down, and then we do some twist, but then it's very passive. You know, to actually load the system, but within all those multi-directions is so genius.
Yeah, you have to load it in all directions, and you have to always work with gravity. You can't be on your back. Like, you know, if you do rotation on your back and extension on your back, you did bridges, you did sit-ups, you did Russian twist, but you never got off the mat. Even if you have severe diastasis, you still have to get off the mat, because you know what the pelvic floor responds best to? Gravity. As
Yeah.
soon as there is gravity on it, the body is like, oh, we have to work. So the beauty of automatic core engagement that comes with gravity, you just cannot replicate it anywhere else. So if you're
Mm.
not working with gravity, even if you have severe diastasis, I think you're missing this automatic function that our body has, is gravity.
I just love you so much. You're so amazing. Just think this is like, it's so obvious, but until you actually hear someone explain it with so much eloquence, the penny doesn't drop. And so it's just fantastic hearing you talk about this. Would you give any advice to older women who have experienced a prolapse? Again, I know it's such a hard question to answer because everyone's different, but are there any key things that you're like, if people with prolapse practice X, Y, and Z, it can be very helpful?
Okay. One, manage constipation. I don't think it's said enough. I don't think women know enough that constipation, if you're bearing down to pass a poop, you are bearing down in the front and the back. You can't bear down just in the back and not in the front. So if you're pushing the poop out, you are pushing the bladder out too. So if you push once or twice to start a bowel movement, that's not a problem. But if you are sitting in the toilet bearing down for 20 minutes, that's not healthy for the prolapse. So do whatever you
Okay.
need to do to manage constipation. Second, don't just do Kegels. That's kind of obvious, right? Like they've
Oh, can you
already been
explain
told.
Kegels? Just in case someone doesn't know what that is, could you please
Okay,
explain Kegels for us?
so Kegel is a pelvic floor contraction. Okay, so when the isolated pelvic floor contraction, when it comes up, is called Kegel. And ideally, when your pelvic floor contracts, it will lift the neck of the bladder up. So the bladder is not sitting on pelvic floor, but it has fascial connections on top of pelvic floor. So when the pelvic floor contracts, it lifts the neck of the bladder, um, and potentially will decrease the prolapse. The how you do pelvic floor contraction, um, I have three favorite cues. One is, imagine you have a tampon which is falling out and you want to keep it in. So kind of pull that tampon back in.
I'm doing it
Two,
right now.
two is, imagine, this is the one that's most often used. Imagine there's an elevator floor inside your pelvis and you kind of bring that elevator up towards your belly button. That's two. And one that I really like is, imagine you have two blueberries and you pick up a blueberry from your vagina, pick up a blueberry from your anal opening, and pull them together like a string.
That pulling together is tricky. I'm trying that and I'm like, wow, I need to
Yeah.
work on that. It's like fanny gymnastics going on. I love it. Okay, so these women need to manage constipation. They need to do some exercise. And what if it's a severe prolapse? Is there anything additional that they need to do? Do you think surgery is a route, or like, what do women do that if they've had a really severe prolapse?
So pessaries are available. Pessaries are little devices that can be put inside the vagina that will usually hold the prolapse up. There are different grades of prolapse, and different grades have different meaning how far out the organ is. So if you are grade 2 or 1 or even sometimes 3, the pessary will pretty much take care of it. Pessary and PT will do it. If it's a grade 4, you can consider surgery. You don't have to. It's not a thing that you have to do. I think a lot of women are scared because they think their organs are falling out. The organ is not
Yeah.
falling out, it's the vaginal wall that's prolapsing, and the organ is behind it. So it's not like your bladder is out in the open. It's the bladder bulge that's out in the open, but your organ is still functioning. So I think
Okay.
that degree of not fear is also not helpful. Um, hormone replacement really helps because
Mm.
the vaginal tissue has to thicken up a little bit. When it thins out, the prolapse becomes much more noticeable. So if you find a good menopause doctor that can prescribe at least local hormone replacement, if you're a good candidate, that can be helpful. And then really exercise glutes, exercise abs, exercise hips. I cannot
Mm.
tell you how many times women did not want me to examine their vagina at all, not look at it. They just said, I have a prolapse. And just strengthening glutes and strengthening hips and strengthening abs improved that. A,
Oh,
a
this is amazing.
squat and a deadlift engages pelvic floor strongly. So I know that squats can make the prolapse more noticeable, but squats can also make the prolapse better. So it's really about
Okay.
how far you are in your rehab and how you do that. So I highly recommend working with a trainer or a physical therapist who's trained to strengthen your lower body.
Yeah, this is
That
so,
can
this
help.
is gold, absolute gold, Nidhi. Thank you so much. And tell me, is there anything that women particularly are doing in their youth that maybe kind of predispose them to something like a prolapse? Is there anything that us young women need to kind of be a little bit more switched on about? I'm thinking of me, I'm quite hypermobile. I used to bear down to go to the toilet, and I tend to sit a lot for work these days. Or is there any kind of risk factors that you kind of look out for to help people just kind of realize the importance of doing their pelvic floor exercises alongside their exercise?
So you already said one, constipation is one. Research also suggests that obesity is another one. There's just more weight going through the pelvic floor. So weight management throughout the life, healthy weight and exercise is important. More deliveries, like more vaginal deliveries, doesn't necessarily predispose you to pelvic floor prolapse, but if any of those deliveries have instruments used, so forceps and what is that called? A vacuum. So instrument deliveries predispose women to prolapse. So if you have an instrument delivery, you probably have to focus more on strengthening the pelvic floor. And then any hormone imbalance,
Mm-hmm.
low estrogen will do that to you. So, and it's usually not the postmenopausal women that have that much. It's the perimenopause. So right when the menopause is about to happen, you still have your period, but your hormones are all over the place. That's time. That's a time that most women start to feel that leaking and prolapse come on. So
Oh, amazing. This is so great. So one of the big issues, I think, I mean, I'm listening to you talk, and what's going through my mind is, oh my gosh, everyone needs to meet Nidhi, and everyone needs to have a pelvic floor physiotherapist, but there's really a lack of pelvic health physios in the world globally, and there's so many women that are delivering. I mean, it's just like it's this huge disservice, actually, to
yeah,
women that are having to bring new people into the planet.
exactly, and not just once, again and again.
Yeah.
Again and again, and with so many sometimes so many complications. It's so important. And I think one of the things that I've seen is, I don't have evidence for this, but I hear this in clinic every day. I had a baby 12 years ago or 20 years ago, and I wasn't leaking, or I was leaking every now and then. If I ran 2 miles, I might leak a little bit. And now, since last year, I'm leaking all the time. Okay.
Mm.
What happened? You're 45 or 48 years old, menopause is around the corner. You just don't have the buffer in your system. You were living for 20 years right on the edge of what your pelvic floor can do. And as soon as you got a little less estrogen, everything falls apart.
Yeah.
So it's this 20 years of living in just a little bit of leaking or just a little bit of prolapse, and then suddenly they just kind of fall down a cliff
Mm.
because we didn't take care of them when they gave birth. We didn't
Yeah.
tell
And
them that that little bit of leaking, a little bit of prolapse when you were young, my age, is just not normal. It's not okay to have that. And there's help.
common but not normal is the
Yeah.
phrase, I think, because you know what was shocking to me is that how on TV now they advertise knickers for leaking. Like it's this normal thing. Oh, you've had a kid, you leak. Here, wear these pants. They will help your leaking. And it's like, yeah, great that those products exist. Absolutely grateful to the people who created them. But at the same time, the message shouldn't be, oh, it's so normal. We should be like, and I think there's something else that's worth mentioning is all of us as fitness professionals should be trained to always question, how is your pelvic floor? It should be just mainstream part of our kind of intake. Let's talk about pelvic floor. That should just be normalized.
Yeah, absolutely. I cannot tell you how many times I get patients referred from other professionals for something else, and then I ask them, "Are you hurting with intercourse, or are you having prolapse? Are you having difficulty?" And they say yes, and no one has asked them. And they are 3 years postpartum. No one has asked them, not their OBG,
Wow.
at least in the United States.
Oh,
So
here as well.
it's so important for everyone to get comfortable asking, talking about pelvic floor. And I think that's what professionals like me are doing on our Instagram. Okay, I gave birth, so I'm going to talk more about pelvic floor, and hopefully that will inspire you and make you more comfortable about talking your pelvic floor. It's because it's like shoulder, it's just inside.
Yeah, it shouldn't be this private thing that everyone's afraid to talk about. That's why when I was interviewing Julie Weeb, and I'm going to interview Sarah Parker, my friend who introduced me to you, I very openly talk about the fact that I had this mild incontinence, because I really wanted to be that it's not the shameful thing that, oh, she's got incontinence. Oh my goodness, what's wrong with her? The strong girl that can do handstands. How is she incontinent? It really should be something that we're not only open about talking about ourselves, but asking in our intake forms when we deal with new clients.
Yes, exactly, absolutely. And the fact that we relate the pelvic floor to bladder health and sexual health only, we don't talk about it, we miss the point that pelvic floor is important for lower back pain, for your core strength, like you said. So if we talked about the other things more openly and we addressed it, I think people would generally just have, at least postpartum women will have less back pain and less SI joint pain, because guess what is stabilizing SI joint more than
it's all connected.
the other things is pelvic floor.
Totally. And actually, I've started doing that now. When people write to me saying, oh, I've got SI pain or low back pain, what do I do? Straight away, what's your pelvic floor doing? Just kind of rolls off the tongue now. Nidhi, one thing that you touched upon, which I'm very curious to learn more about, I don't know a lot about it, is vaginismus. People that present with painful sex, trouble getting their tampons in and out. Can you offer us a little bit of background about that, and maybe some solutions and kind of things? I mean, because people don't have access to amazing people like you, what are things they can do themselves to help?
So vaginismus is a condition where when there is penetration, the muscle of the vaginal canal or pelvic floor around the vaginal canal contracts strongly and close. There's a lot of research thinking into why it's happening, and we don't necessarily know. It's not just a physical problem, some part of it definitely psychological. There's a fear, tension, and pain cycle. So there is intercourse, there is pain, your body develops tension, there's sympathetic response to that pain, you develop tension, which causes more fear, which causes fear, which causes more tension, which causes more pain, and you kind of get stuck in this cycle. So one of the things I tell women is, first of all, you need to give your pelvic floor pain-free experience. That can be your pinky finger, that can be a very small dilator, that can be that can be your partner's finger, or anything so small that it doesn't hurt. And if that small still hurts, just outside of the vaginal opening, just touch something that doesn't hurt, and then you have to go from there slowly and slowly. I say, kind of convince your body that it's not in danger. Whenever we are in danger of any kind, one of the things that contracts strongly is pelvic floor, because our very important organs are there, and evolutionarily our uterus is there. So our body's like, oh, we don't want to lose a baby, we don't want to lose reproductive ability, so they protect. And so dilate, I don't know, should I explain what dilators are? So dilators
why not? Go in.
Dilators are these small, they look like a vibrator, but they're medical instruments that you can put inside the vaginal
And
canal
then they open.
and slowly train your body to not react to it. I don't like to say stretch it, because you're not really stretching the vagina with small dilators. What you're doing is you're putting it in and telling your brain it's okay, there's
Okay.
no danger, and then you leave it there, and then you kind of move it in and out, and more times your pelvic floor has this pain-free experience, less and less guarding it gets. Now, the
Okay.
primary vaginismus, this is secondary vaginismus, which starts after a UTI or an injury or a sexual intercourse injury. Sometimes it's primary vaginismus where there has never been pain-free sex. It's always been painful, and that's the kind we don't quite understand why it happens. But there definitely can be psychological and psychosocial factors happening there. So for those patients, of course, working with physical therapists, but also working with a counselor or a
Mm.
psychotherapist to sort of think about why it might be happening. It doesn't have to be physical. There might be something in your childhood, something in your life that you have been holding. It doesn't have to be trauma or abuse. It can just be stress that you're holding.
Yeah.
Some people will just hold their stress in their pelvic floor. So releasing those stresses, and then again coming back to pelvic floor and convincing your pelvic floor it's okay. There is no danger anymore.
Gosh, it's a long road for women, isn't it? It's a long road of recovery that convince the brain and to convince the body.
It seems like it would be very, very long. It's not that long. Once you
That's
start
great.
doing it, we typically see results in 3 months, 6 months.
Amazing.
Where you can. It's a daily practice. So yes, of course, it's a lot of work for those 3 6 months, but there are definitely good results. The absolute worst thing is to try to shove those dilators in, thinking that you're stretching something, because you're really not stretching. If you're shoving
Mhm.
them in and causing pain, and it's painful, then you are absolutely making the problem worse. And the same
Okay.
thing, if you're just tolerating sex that's painful again and again and again,
That's going
you're
to make
just
it worse.
making it worse.
And tell me,
Uh,
is the cueing around engage your pelvic floor, engage your pelvic floor? Because in yoga, that's a big one, especially in the Ashtanga traditions. They get women to engage their pelvic, I mean, not just women, all people, to engage their pelvic floor for very long periods of time in a static hold. And this is like part of the practice, it's something that's very much expected, and you're expected to do it daily as well. Could that contribute to pelvic floor dysfunction?
yeah, yeah. That's I would think that is probably, I don't know that, I haven't seen that specific yoga practitioner, but I've seen it a lot in dancers. They're holding
Mm.
their pelvic floor because they're told that they have to hold, or gymnasts that they have to hold the pelvic floor for their function to be strong, and then they end up leaking, or they end up having painful sex because their pelvic floor has lost the flexibility to
Mm.
open. So yeah, definitely. And I don't think holding the pelvic floor or holding any part of your body in a constant hold for a long period of time is functional or beneficial.
Yeah, I agree. And it was funny. We actually did this little thing in my core workshop where I got everyone to like make little biceps. I was like, okay, now we're going to try and do our favorite activity. You can do whatever you want, dancing, a vinyasa flow on your yoga mat, whatever you want. Try and do whatever you want and just hold your biceps in this thing. And we had such a laugh doing this because obviously, A, you look ridiculous. B, it feels ridiculous. You can't really do much if you're holding any muscle in a static hold. It's very impractical.
Yeah.
And it's like, why would we expect one part of our body to have a set, rigid state and not another part of our body? All parts of our body have to respond to A, the load that they're under, and B, it has to be task specific.
Yeah, exactly. And I think the probably this constant hold came from the place that people had pain, and we did the constant holds and it made the pain better. But you, like, I look at my baby, he's not holding anything, right? He's
No.
always, so how is he functioning without holding? He's strong, he can stand, he can really,
Yeah.
really push off with more weight than his own body, because one, his posture is close to ideal, right? His thorax, his rib cage and his pelvis usually line up when he's standing. And two, he's breathing into his diaphragm or using his diaphragm. I think posture in our daily life, when we're sitting for a long period of time, posture gets out of alignment or out of awareness, and then the breathing goes down, and those two factors make the core that was automatic not automatic, and now you have to go and talk to it again and again and again, and people end up just thinking that, oh, we're going to hold this because that's going to make it better, but it's not. You have to talk to it, but you really, how are you going to make it automatic again is going back to the basics of breathing and posture.
Yeah, and it's such a hot topic, posture, because I was always really flying the flag, posture, 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 but then there were a lot of people kind of in the wellness space saying things like posture doesn't matter at all. And it was like, oh, okay, maybe I have to like go back to the drawing board and look at things again. And I'm very much still on the fence, where I think that the way we've been talking about posture, about it, definitely if you have bad posture, you're definitely going to end up in pain. There's obviously no research to back that up. But at the same time, it doesn't mean that posture doesn't matter at all. Obviously, the way that we carry ourselves, our form, is going to have an impact. So it's really nice to hear you talk about that.
I think we're missing the boat with posture, and I've been talking to a lot of professionals about it, because in our space also there are people saying it doesn't matter how you lift. You can lift with your back bent, and it's because research shows that bending your back is not going to cause pain. Two things. I think one is, it's not a posture. It's not a bad posture, good posture. It's more about, do you know where your spine is? If it's bent, it's bent. But do you know? Do you have awareness? Because, and then, do you have variety? You can lift, okay, it doesn't hurt if you lift with your back bent, but can you also lift with your back straight? Can you also lift with your back extended?
Amen.
So that variety gives your body resilience, which is missing when you're not aware, right? And I think the second thing with posture that we're missing is, yes, posture probably doesn't cause pain, but good posture or a more aware posture does make you more efficient. Can you run faster? Can you lift heavier? Can you stand longer? Even if you're pain-free, but you can run faster,
Fatigue.
I would say that is better. Yeah. So
totally. And I love the way you described that. That is so smart, because I think the way that we're looking at pain as a single variable, which is not how the body works.
That's my handle, think beyond pain, because really I'm tired of talking about pain in all my career. I want to help pain, but really think about function, right? Think about having sex, think about not leaking, think about running, think about lifting, and pain will get better by itself. You have to stop obsessing about pain.
Can you please tell everybody where to find more of you? I know I mentioned your handle, but is there anything else you want to share with our listeners?
Yeah, so my practice is in New York. I have two locations, one in New York, one slightly north of New York. I do remote work. There you can contact me through my page. You can DM, but my Linktree has all the information to contact me. There is a free postpartum booklet in my Linktree. So if you want to download, if you're pregnant or if you just gave birth, download that. It has basics of all the contractions and deep core contractions I talked about.
Amazing.
And if you have any questions, feel free to DM me.
You are the best. Honestly, thank you so much for your beautiful brain. I'm going to have to interview you again. So just expect a message coming through into your emails.
Anytime.
All right, my love. Thank you so much for your time.
Thank you, Celeste. Bye.
Bye, my love.